Good afternoon and welcome to all of our attendees who have joined us here today, and for those of you who have accessed and are watching this recorded event. My name is Jamie Nelson, and I'm one of the RN team leads for the behavioral support team with the North Simcoe Muskoka Specialized Geriatric Services. This year, we have moved to a virtual platform in order to provide our annual Leadership and Innovation in Responsive Behavior Conference, which has been taking place during 3 one-hour sessions spread over 3 months. Welcome to the Leadership and Innovation in Long-Term Care, Session 2. Please be aware that today's session will be recorded, and you will be able to access this recording as well as the first session on the North Simcoe Muskoka SGS website. For this reason, all attendees' microphones are muted and videos are off. You will notice that there is a question and answer tab on the bottom center of your screen. Please use this to type in any questions for today's presenter, and we will allow for some time at the end of the presentation for your questions to be answered. We do have someone monitoring the question and answer box, so please feel free to enter your questions in here at any time. For today's presentation, it is my pleasure to introduce Heidi Flynn, who will be speaking today on music therapy, intervention-based support for geriatric mental health. Heidi Flynn is a registered psychotherapist and certified music therapist. She is the owner and director of Music Therapy Services of Simcoe County and has been working as a music therapist in our community since 2001. In addition to supporting clients with special needs, Heidi's team of music therapists currently supports seniors in 16 long-term care facilities in all corners of Simcoe County and Muskoka. Heidi has a passion for treatment-based support and seniors' mental health, especially those struggling with responsive behaviors. So with that, I introduce to you Heidi Flynn.
Thank you, Jamie. Well, thank you so much for having me. I was very much looking forward to this. Like Jamie said, I'm very passionate about mental health for seniors, especially responsive behaviors. So I am going to dive right in. And please feel free to throw up your questions, and we'll pause a couple times throughout, excuse me, to answer any questions you have as we go. So for today's presentation, I'm hoping you'll walk away with a general understanding of what music therapy is. We're going to investigate different applications for music therapy in long-term care. We're going to discuss resources available in our region. And then at the end, I'm going to close off with sharing strategies on how all of you can incorporate music into your own self-care practices. I think we can all agree that with the pandemic and being isolated from people, self-care has been a very important topic. And throughout the pandemic, we've seen lots of examples of people using music for that. So I'm going to arm you with some good tools before you leave today. So I wanted to start off a little bit about the history of music therapy. Music has really always been around in cultures. It's been used for healing and for mental health. Some examples in the Bible: King Saul's depressive symptoms were alleviated by David's harp playing. In ancient Greece, healing shrines had hymn specialists as well as physicians, so they understood the role that music played in healing. Also, indigenous cultures across North America and the world really have always incorporated song and music into their rituals, and it's been a very central theme to all of that as well. So, you know, music is always, since the beginning of time, really, it's kind of that thing that people are drawn to. In terms of us becoming a more clinical or formalized profession, it really kind of got started in North America after the Second World War, although veterans came back from war with PTSD. And the hospitals actually had musicians come in to volunteer, and they would sing and play for the patients. And the doctors noticed, wow, like this is really improving outcomes for some of these patients. And at the same time, the musicians were like, we need to know a lot more about this so that we can help these patients even more, rather than just performing for them. So since then, there's been the development of lots of formalized training Currently in Canada, there's 6 post-secondary or master's schools that offer music therapy across the country. So it's pretty small. It's kind of specialized. And the thing that makes me most excited since I started, excuse me, almost 20 years ago, there's a lot more research. When I started 20 years ago, there was a lot of anecdotal research, but over the last 2 decades, our profession has really worked hard to create more empirical data to really show that it is effective and, excuse me, how it's effective and why it's effective. So that's been really exciting to kind of see that grow over the course of my time working in the profession. So what is music therapy is something that as a music therapist I'm asked all the time. Secretly, I dread being asked it because it's such a difficult thing to answer because there's very diverse ways you could answer this. The official definition is music therapy is a discipline in which certified music therapists use music purposefully within therapeutic relationships to support development, health, and well-being. Music therapists use music safely and ethically to address human needs within cognitive, communicative, emotional, musical, physical, social, and spiritual domains. So I always feel like this is so wordy, and basically we use music to work on non-musical goals, and those goals can really change depending on the client that we're working with, and I'm going to get into a little bit more of that in some slides coming up, just about some of the different ways we, myself and my team, use music. So yes. A little bit about music therapy credentials. When I started 20 years ago, there was not, anyone could go out and say, I'm a music therapist. I'm a musician and I'm working with people in a nursing home or in a hospital, and so I'm a music therapist. And there's been a lot of different training and things that have come into play that make it so that you can't just say that if you're using music that you are a music therapist now. So the main credential that you would need to see in Canada is MTA, which means a certified music therapist. For us to get that credential, we need to complete a minimum our undergraduate degree in music therapy, and then also complete a 1,000-hour internship and write a board exam. Once someone passes the board exam, then they become a certified music therapist. So there's a lot of training around psychology and how to use music effectively that is all incorporated in that training. There are also master's programs now, and so that is a MT, Masters of Music Therapy, which is further schooling education, but it's not required to work as a music therapist in Ontario or in Canada. Neurologic music therapist is specialized training that, excuse me, many music therapists choose to get so that they have further training in how to use music in a very medical model way to work on brain development, especially for stroke or brain injury recovery. And I'm going to talk a little bit more about the neurologic music therapy in a moment. The other big one is registered psychotherapist. So I think it was about 5-ish years ago now, the College of Registered Psychotherapists of Ontario was born, and music therapists are eligible if they meet the requirements to be part of that college. And so when the work we do and the goals that we're working on fall under the mental health domain, often we would be working as a registered psychotherapist. Therapists do require master's training to be eligible for that credential. And yeah, so registered psychotherapist is mental health, whereas the neurologic music therapist or regular music therapist is more developmental or rehabilitative work. So go into that a little bit more in detail. So all music therapists work to work on goals. I like to say that what we do really focuses on mental health at the forefront. I think all of us can identify how music is so tied to our emotions, and why it would work so well to help someone's emotional well-being. But when we work as a music therapist, or a registered psychotherapist, we're working primarily on mental health goals. So it could be depression, anxiety, responsive behaviors. A lot of the work we do in long-term care with our seniors is mental health focused, motivation, social isolation, all of those things. Um, One of the things that I love about this discipline in long-term care, for mental health treatment, is it doesn't require verbal processing. When if I was struggling and I was experiencing anxiety or depression, I would go see a social worker or a psychotherapist or a psychologist, and we would talk about things and we would deal with it that way. But for a lot of our clients that we support in long-term care, or with dementia out in the community, engaging in a talk-based therapy is not typically going to be very successful, perhaps because they have hesitation and stigmas about engaging in that type of intervention. Um, More importantly, because their ability to communicate with words is often quite compromised. And so music therapy gives us the ability to start working with them without having to talk at all. And later on, I'm going to share a couple of clinical examples on what I mean by that and how I've seen it work so wonderfully with different clients in the past. And then the flip side of the mental health side is the neurologic music therapy. And I like to say there's always kind of two sides to the fence. And the neurologic music therapy focuses more on developmental goals with children with special needs, or in this case, it could be working on rehabilitation after a stroke or a brain injury. We do support people in the community. We've been into RVH in the past to support people who are recovering from a stroke. The neurologic music therapy, it's a medical model with evidence-based interventions, and it's really been shown to enhance outcomes for people who have suffered some injury to their brain in terms of recovering function. So why music therapy works? The first thing that I think everyone can really identify with is music taps into our emotions. If you think about like a favorite song, I'm sure everyone can think of that song that really gets their heart, or maybe that song that brings a tear to their eye, or maybe it's that song that gives you chills down your spine or on your arms. Music, without us having to intentionally try, our bodies respond to music, which makes it a fantastic outlet for connecting with people who are struggling to maybe connect in more traditional ways, like talking and that type of thing. The other thing that I love, especially in our long-term care work, is music is tied to our memories. We know that reminiscing is a really important piece to aging. And by playing certain songs, we can really open those boxes, those memories for the residents that we support, and help them recall the fondness or the joy or sometimes the sorrow, and that's okay too, of what memories they have tied to these different songs. So often we'll have residents or clients request certain songs, and they'll listen with tears in their eyes because it's kind of a happy, sad memory, but it feels good sometimes to go there and revisit those things. And again, that whole piece can happen with zero talking. Sometimes when we're working with our clients, we'll see them tear up, and they're not able to always tell us why, but we know that we've hit something, and it's probably something meaningful and helpful. I know that we always worry about having a tearful reaction to music, but that cathartic release can be very healing as well. And sometimes when we're struggling with feelings of depression or isolation, we kind of want to and need to go there to let it out. The other one is music stimulates brain plasticity. This ties back to the neurologic music therapy piece that we were talking about. And what they find, and there is some research that I'm going to touch on in a little bit as well, that the music and the rhythm, it really helps to lay down new neural pathways to acquire skills and kind of go around parts of the brain that are damaged. Aphasia, it's been super successful in helping. A really famous example is, I always get her name wrong, I feel like it's Kathy Gifford. She was a politician down in the States and was shot in the head, and music therapy, specifically neurologic music therapy, played a really big part in her recovery. She struggled to speak, but she could sing. And so by using the rhythm and the music and the singing, it allowed her to kind of bypass the broken bits, the damaged bits in her brain, and learn new ways to be able to access speech and communicate in that way. It's also used for a lot of motor skills, gait training, and also for some cognition skills as well. And then the other one is music impacts our neurotransmitters in our brain. There's been a lot of studies about cortisol and oxytocin and dopamine especially, and they find that listening to favorite music, preferred music, will increase your dopamine. Excuse me. So as will, it'll increase oxytocin as well. And actively engaging in music will further enhance those responses. And also they find that listening to preferred music will lower the cortisol as well. So all of these things are happening at an automatic level. There's not a whole lot you can do about it. The trick is getting the right music that's going to elicit those really positive responses. And that's where music therapy comes in. So the next piece I wanted to talk a bit about is how music therapy is different than entertainment. And this is a really important one for me because I like to say that all music has some therapeutic value to it. Kind of like if you think about if you have a sore muscle in your back and you get your partner to massage it for you, it's gonna feel nice, it's gonna be helpful. Maybe not as helpful as going seeing a registered massage therapist. So I kind of like to compare the two that way. Your music therapist is going to be able to know exactly how to get in there and get it done as best as possible. But all music has the benefit to be has the potential to be beneficial. I know that there's been a lot of movements about using music in memory and the iPods. Excuse me, musical entertainment is always a favorite program in nursing homes, and rightly so. All music is good music, usually. There's very few occasions where I would say there's areas of concern or risk in using music. And often, staff in the nursing homes, excuse me, staff in the nursing homes can't tell just by looking at it the difference between what we're doing and what an entertainer's doing. So the first piece is we move music from a passive activity to an active experience. So what that means is we are actively engaging our clients to sing, to choose songs, to play instruments, to engage in dialogue, maybe some reminiscing. We're very purposeful in the types of songs and activities we're doing depending on the clients we're working with. We also are really wanting to kind of not push them, but if they're kind of here, we want to push them a little bit farther. We want to encourage them to open up and to express themselves and to engage. This being said, we know that sometimes there are some residents and clients that their best participation is active listening. and that's okay too. But we do like to say active listening and not passive listening, because we're constantly checking in with them. We're not just singing music and then we walk away. We're checking in with them. We're giving them opportunity for feedback. And we're responding to them in the music we're providing, which I talk about in point number 3. So the second point is, with music therapy, we're not concerned with musical outcomes. Often when people are learning an instrument, that's the goal, is to be able to sing better and be on tune and keep a rhythm and all of this. And we don't care. You sing off tune, you sing not in time, you shake that maraca in a really erratic, not rhythmical way, and that's great, because music therapy is all about expressing. It's connecting with the music and expressing yourself. So there's no right or wrong, just go is what we say. The third point, which I think is one of the ones that's most obvious to music therapists, but I think it's not always as obvious to other people. If I go to a performance, whether it's at a concert or if it's, you know, a person who's coming into a nursing home to sing for the group, they have their set of music. They're going to sing the songs that they like the best, and they're going to sing them in the way that works for them. And that's fantastic. When we do our music therapy, it's not about us, it's about the client. And so we might take a look at the song and be like, well, geez, they can't sing it this high. In the book, it's written way up here, but that's too high. So we're going to bump it down so they can sing along with us. Or we're going to learn songs that maybe we don't really like, but that's okay. It's not about us. But we're going to do songs so that we can you know, connect with what's going to be most meaningful and familiar for the people that are right in front of us in that moment. Sometimes it's important for us to look at different cultural music and different religious music, and often we'll use videos or YouTube or recorded music to support that. We know that it's very important for us to be culturally sensitive and not really hack something that's going to be important or significant to that person. But we really want to try and make the music, it's all about the client. And I'm gonna just do a quick example here. So if, say I have a resident who is super stressed out, I know that You Are My Sunshine is their favorite song. As a PSW or a nurse or anyone, I could go in and put on that song for them. But there's a lot of pieces about that I have no control over. I can't change the tempo. I can't change the key. I can't change that. When working with a music therapist, we go in and we look at that client and we know, or we try to know what way we can sing that song. Because I could sing it like this. You are my sunshine, my only sunshine. Or I could come in and I could say, you are my sunshine, my only sunshine. Those two different examples are going to yield very different emotional responses. And sometimes when we're working with our clients, we might decide, oh, geez, they're getting really agitated. And so we can, in the middle of the song, completely dial it back and help them to feel more calm and centered and grounded. We can also adjust the tempo. So if I have someone who's desperately trying to sing along, but they can't keep up, I can slow it down so that they can jump right in and they can sing along with me. Or if someone is so excited and they're racing ahead, then I just jump ahead with them. And so we're constantly in that state of client biofeedback, essentially, where we're matching the music to our client, to their emotional needs, to maximize their level of participation and engagement. That's something that you don't get when you have a CD or most musicians. They just do it their way. And then the last point is the fact that music therapy really is a goal-driven clinical intervention. So when we're supporting our residents, sometimes what we're doing is very preventative, and the goals would be not as intensive, But often we're working with people, for example, responsive behaviors, where we're working actively to give them an emotional outlet that's appropriate, that's non-disruptive, allowing them to have an activity or a moment where they can feel calm and peaceful and even successful. Those are all super important experiences to support their mental health. Sometimes it might be giving them the opportunity to complain or to vent or to let out what's in there. But always what we're doing, there's a goal, and we're intentionally trying to support some need in that resident, whatever it might be. So before I dive into some research and some case examples, are there any questions at this point that we can pause for?
I'm not seeing any in the question and answer box, Heidi, but there have definitely been some comments that people are so far really enjoying your presentation and are already learning so much.
Oh, good. Yay. That's great to hear.
So if anyone does have questions, please feel free, as mentioned before, throw them in the question and answer box, and we'll make sure to answer them before the presentation is over.
Okay. So I wanted to, Jamie actually asked me to share some research, and I have to admit that I love sharing case examples because I feel it really brings the work we do, makes it come to life, whereas research, I find it dry, but I know that it's important. And so I did pick some examples to share with all of you. So the first one is making reference to the neurologic music therapy. And so and I did on here, there's the web links. If any of you want to go and like read them more thoroughly, please feel free. But the first one, it was a paper that reviewed research data and clinical applications for neurorehabilitation in speech, language, cognitive, and sensory motor domains. Several studies have shown evidence for neuroplasticity induced by MIT, which is one of the neurologic music therapy techniques we use, called melodic intonation therapy. This reroutes speech pathways from the damaged left to the language capable regions of the right hemisphere. And it's really cool too, because this is a more medical model that was born in the States. They do a lot of brain scans. So they have like that really great concrete data that shows what's happening in the brain, which I find really fascinating. But what they found in this paper, that neurologic music therapy has established evidence-based techniques to retrain and re-educate brain and behavior functions in neurologic disorders and injuries, particularly in the area of motor recovery in stroke, which is fantastic. We know that there's studies as well. This one, I didn't see it in there, but I know that there are studies. I've been at talks with other therapists where they find that using music therapy in combination with your traditional rehabilitation programs can enhance your recovery, which is really fantastic. So the second one I wanted to share with you is a study examining the effect, I can't say this word, efficacy, there we go, of music therapy in the treatment of behavioral and psychiatric symptoms, which is like right up my favorite alley with all of the responsive behaviors and that type of thing. So for this study, it was 59 persons with dementia were enrolled. All of them underwent multidimensional assessments, including mini-mental, Barthel Index, neuropsychiatry inventory. And they did these at week 0, or week 1, week 8, week 16, and week 20. Subjects were randomly assigned to experimental or control groups. Music therapy sessions were evaluated with standardized criteria. The experimental group received 30-minute music therapy sessions every week, whereas the control group received educational support or entertainment activities. And what this study showed was that the group that received music therapy had significantly, their NPI scores significantly decreased at week 8, week 16, and week 20. And the markers that they found were most improved were a reduction in delusions, agitation, anxiety, apathy, irritability, and nighttime disturbances as well, which I find interesting. They also noted that the empathetic relationship and the patient's active participation also improved as the experiment went on, which I think is interesting too. The next study I wanted to share is individual music therapy for agitation and dementia, an exploratory randomized controlled trial. So in this study, the aim was to examine the effects of individual music therapy for agitations in persons with moderate to severe dementia living in nursing homes, and to explore its effects on psychotropic medication and quality of life. So I'm sure, especially all of you, I'm sure, are very well aware of the need for medications often to help support behaviors. And this is why I wanted to highlight this one. So this study had 42 participants, and the study ended up showing that a 6-week period of individual music therapy sessions held weekly, it reduced agitation, disruptiveness, and prevented medication increases in people with dementia. The positive trends in relation to agitation, frequency, and quality of life. They did note it's a relatively small and short-term study, but I wanted to highlight it because it really does reinforce what I've seen from my own personal experience. And then the last one that I wanted to share, excuse me, is a meta-analysis of randomized controlled trials pertaining to the efficacy of music therapy on disruptive behaviors, anxiety, depressive moods, and cognitive functioning in people with dementia. It included or examined all the randomized controlled trials found in literature relating to music therapy for people with dementia over the past 15 years. So they really did dig deep and kind of pull everything together. And they found music therapy exerted a moderately large effect on disruptive behaviors, a moderate effect on anxiety and depressive moods, and a small effect on cognitive functioning. Individual music therapy provided once a week to patients with cognitive functioning and manually guided in music intervention. Construction is suggested. Sorry, I think I read that wrong. They're recommending individual music therapy for that. Group music therapy was most often provided several times a week to reduce disruptive behaviors, anxiety, and depressive moods. Ultimately, music therapy is a cost-effective, enjoyable, non-invasive therapy and could be useful for clinical nurses in creating an environment that is conducive to the well-being of patients with dementia. So this is something I know and I always go on about. And I'll be honest, I'm sure that a lot of you here are familiar with music therapy, probably with some of my employees, because I know that we work or support people in many of the nursing homes across the county. So maybe it's something you already know and have seen as well. So now it's my favorite part. I want to jump in and share some of my favorite case examples, clinical examples. These are actually real residents that I've supported in nursing homes in Simcoe County over my time. So if it sounds familiar, please remember confidentiality is important. And I'm not using real names, obviously. So the first one is probably my favorite client of all time. I actually wanted to name my child this person's name. That's how much I adored this client. So it was a 80-plus-year-old male diagnosed with Alzheimer's disease. He had a history of agitation, calling out, and disturbing or disrupting his peers. He was a very to look at him, he was a very small, non-aggressive looking old man in a wheelchair. So he definitely did not look intimidating or concerning. And his POA had me come in and do weekly individual music therapy for him. And it was interesting because for the first many times, I thought this client hated me and hated music. And I really, it was earlier in my career, and I really struggled with, how long do I keep trying this before I just give up? He would often sit in his chair and he would scowl and his arms were crossed and he wouldn't sing and he wouldn't engage and he wouldn't answer questions. And if I asked, did you like it? He'd say no. And if I sat close, he'd try and kick his leg at me, like not with an intent to hurt, but just letting me know that he was in a bad mood. And so I thought, okay, I need to give it a bit of time to see if I can develop a rapport with this individual. And I think it was after about maybe almost 2 months, I showed up for his session one day and the nurse pulled me aside and said, you will never believe this, but this gentleman sang Tipperary for hours after you left last week. And I said, that can't be right. There's no way that is the person that I have been desperately trying to connect with for almost 2 months. As it turned out, it genuinely was. This gentleman, he turned into a singing machine, and he would sing everything with me, and it was completely off key and monotone, but he belted it out. And it really, I think me showing up for him every week, we developed that therapeutic relationship that we talk about in the clinical side of what we do, why we do it. And he started to express himself in appropriate ways. They weren't beautiful, but that's not the point. And what we found was that what used to be calling out for help, and I know that you all know somebody who does this, turned into him singing My Bonnie over and over, which, you know, can be equally irritating, but it is a little bit better than help, because everyone else can sing with him. And it really did have a positive impact on everyone around. You know, he would sing the same little bit on loop over and over. But it gave a way for other people to have positive interactions with him. And nursing staff were phenomenal because they quickly picked up, oh, when he's grumpy, I can start this song and he's going to just jump right in. And that it became a really helpful tool for everybody. He did stop kicking me. It was great. But it's always one of my favorite examples because it shows that even though I couldn't tell for a long period of time, the music was getting through and it was having an impact, and me showing up for him was having a very positive impact without me even knowing it until we got a little bit further into our sessions. So I always love sharing that one. The next example I want to share is a code yellow. And it was really serendipitous that I was able to step in and assist the facility in the midst of this. It was an 80-plus-year-old woman diagnosed with dementia. She was ambulatory, had aggression, periods of more extreme confusion at times. I'd been working with her individually for a while. She did not always do well in group programming because she would lash out. She would get verbally agitated towards others. And so individual was great though. We got to cater the music to her preferences. We did a lot of Elvis. That was her jam. We did Elvis and she would sing. And it was so nice, I think, for everyone to get to see this woman really show a great side of herself. When often with our residents that struggle with their mental health, we see a lot of the negative, and it's hard and it's frustrating and it's disruptive and it impacts everybody, the staff and residents alike. So to be able to have these snapshots of a different side of that person, and maybe it was a piece of who she was before dementia really got in the way for her. Really fantastic for the staff to get to see that as well. On one particular day, I was actually on my way to go see her and unaware that a code yellow had been called. I must have been in the elevator or something. I didn't hear it. And when I showed up, there was a lot of staff there trying to help de-escalate the situation. The resident had gotten into another resident's room and was convinced it was hers and no one could get her to leave. And she was trying to physically lash out at staff that tried to remove her from the space. There was two other cute old women that were, I shouldn't say cute, that's not what I mean, but they were very sweet, kind, and kind of scared women who were in the room, because rightly so, it was their room. And so I came in and I stepped in and flexed my music therapy muscle, I guess you could say. And the first thing I did is I turned off all other stimuli. So I turned off, there was a radio and a TV on in the room. I turned all that off and I asked all the staff to wait in the hall, and I quieted and calmed the situation. And then I started to sing very quietly. She was not the resident. I was going to jump in with a boisterous version of You Are My Sunshine. We started very calm and soft, and she was very upset. And I remember I actually turned my back mostly to her and just kept it in the corner of my eye, because singing at her was not helpful. The other women were there, I sang to them, and I kind of ignored her. I was keeping my eye, obviously. And after about half of the first song, she stopped fussing and complaining about me being in there. And by the second song, I was able to look at her and ask her what song she would like to hear next. And I think honestly, by the third song, we were singing together, arm in arm, walking out of the room. And I really credit the fact that we did have a bit of a rapport, a bit of a relationship, but the music, it was able to take her from here, like from an 11, and calm her right down to about a 4. And I remember some of the staff were kind of watching with mouths open, like, how did that work? How did it happen? I'm like, well, it's music, it's magic. It's not really magic. It changes the brain, as I already shared with you, so you know that. The third example that I want to share with you, it's a little bit different. This is a younger man who I worked with kind of not that long ago, actually. He was actually in a retirement home, not a nursing home. Diagnosed with dementia, but I would say he was in much earlier stages. He was able to converse and have dialogue. He was a veteran and was also diagnosed with PTSD. The other concerning factor was he was very isolated. He never left his room for meals. He was always feeling unwell physically and was very isolated. So I came in and worked with this individual doing half-hour sessions every week. And his music therapy really was definitely a lot more psychotherapy based. There was a lot more discussion and reminiscing, and he really loved to share stories about his family and about his past. And he was very much able to share with me the songs that he connected with the most, which was fantastic. Sometimes we're left to guess a little bit when we're working with our residents or clients who have more progressed dementia. But he was very much able to communicate what he loved and what he didn't, and that was fantastic. His goals for music therapy really were to prevent social isolation, to give him an opportunity to express himself, and the emotional release. I think that his experiences in the war were very difficult for him to kind of move through. It was very interesting because after a relatively short amount of time, he opened up and shared very intimate details of the circumstances that really led to him developing post-traumatic stress disorder. And the music was a very effective, kind of non-intimidating or assuming avenue for us to connect. I think that had this gentleman in his 70s, if they'd said, well, you're going to go see a psychologist or a social worker, he might have responded differently. I think the music really is a nice buffer. It's a nice way, it's just a nice, well, how am I trying to say this? It's a really nice way to connect, that it's friendly and it's not, it doesn't put anyone on the spot. And by playing the songs and singing the songs that spoke most closely to his heart, it allowed him to tap into all the feelings that he had about his different life experiences. And he was able to release that. He was able to talk about it. And really the quality of life for him, I think, was enhanced tremendously through these sessions. And he really looked forward to our weekly visits. And honestly, they really often went much longer than half an hour because he loved to talk. But that's what I was there for. It was, that special quality interaction that I know in nursing homes that everyone is run off their feet and don't have the time to sit with someone for half hour, 45 minutes to let them really let that out. I just know it's a luxury that we just don't have the way the system is set up. So it was really nice for me to be able to give that to him, and it was really nice for him to be able to receive that. So before I go into my kind of last bit, are there any other questions?
We do have a couple questions, Heidi.
Okay.
So one, how do you find what music would work for a client without them being able to share that with you or have someone share it on their behalf?
Absolutely. That is probably one of the things as music therapists we, I wouldn't say struggle with, but it is very tricky. So the one thing I know is music, we connect with music that was most influential during a certain period of our life. So if all of you think about your favorite bands, your favorite artists, your favorite songs, probably the things that you think of first are songs that were really popular between the time you were 15 and 25. Not always, but it's a great way to kind of take the wealth of music, the billions and billions of songs, and kind of pare it down to a much smaller sect that we can work from. I'll give a perfect example. So I was a 90s grunge kid and grew up on Pearl Jam and Chili Peppers and some of that music. Now that music was not very mainstream when I was in high school, but that's my favorite stuff. But if I were to listen to songs that were popular when I was in high school, so say the Spice Girls or some of the boy bands or any of that type of music, I'm going to know it and I'm going to sing, and my body is innately going to respond to it because my brain and my body know that music because I heard it a lot, because that's what was culturally relevant during that time. And so although I always love to try and tap into what is someone's favorite, as long as I can kind of land in the things that are going to be familiar, it's going to have that same positive impact. So when we are working with a client, we take a look at, were they religious? Are hymns important to them? How old are they? So what music would have been most popular in their 15 to 25 kind of gap? We also know that as dementia progresses, the songs and the music they learned as younger children will stick the longest. And so we will go back to the songs that from even earlier in their childhood, the songs that likely their parents sang to them when they were kids. The other thing that we do is we watch our clients very, very closely. We're constantly looking for facial expressions, for movement, maybe moving of fingers or toes, for any kind of response or reaction to give us that feedback that we need to know if we are in the right ballpark or if we're really not in the right place at all. So I think that kind of answers the question. It's a little bit of detective work and a little bit of trial and error. And then it's always helpful if we do have a bit of guidance, but sometimes, honestly, families maybe don't always know the right thing to suggest. They might think they know, but maybe they don't. So we really watch the client or the resident's responses.
That's great, Heidi. I have another one here. As an RN on the long-term care floor that might be quite busy, how would you, or what would be some things you would suggest on what they could do to incorporate music therapy to help residents that would kind of be like a quick, is there something that they could do pretty easy to incorporate that?
Sing.
Sing.
Just sing. And it doesn't have to be pretty. It can be out of tune. But if you're singing with joy and intent, your residents are going to feel that emotion and they're going to respond. I always say if there's a resident that's struggling, just sing. And if you can find a song that they like and they're familiar with, it's going to be even better. But it's something simple we can all do. I remember my son is doing school online right now, and his teacher every morning, as she was waiting for all the kids to get onto the Zoom call, she'd play songs. And every morning was different artists. And it was fantastic because it kind of sets that tone. And I fully appreciate the difficulty of the job that our nurses and our PSWs have. I've worked alongside a lot of you for 2 decades, so I know it's not an easy job. But I also know if you were to whistle while you work or sing while you work, it's going to, first of all, improve your mood. It's going to change your brain chemistry, but it's also going to do the same for your residents, and it'll help. So that would be my easy, quick fix suggestion.
Do you offer support in the community as well?
We absolutely do. Right now, we're working with someone with Alzheimer's who's living at home with his wife, and they actually choose to come into our clinic to see us. So it's an outing for them, but we do home visits. Right now, we're also doing online groups with the Alzheimer's Society. So some community members and their family, we're doing that programming, and it's going very, very well. We've had lots of positive feedback. So yes, we will help anyone who wants help if we can, definitely.
Perfect. That's all that I'm seeing in here.
Perfect. Okay, so I'm going to go into a little bit more. I know we just have a few minutes left about music therapy in our area. So I know that Jamie mentioned we have a team of, we've been in Simcoe County since 2001. Right now, we're currently in 17 long-term care facilities across the county. We go as far north as Muskoka Shores, and we go actually past the borders into Thornbury and down south as far as Shelburne. And we have a lot of homes in Aurelia and Barrie, Alliston. We kind of cover it all. We used to drive all over the place. Now we're doing a lot more online, but most of our team, all of us are certified. Most of us are registered psychotherapists or are in the process of becoming registered with the college. And 2 of our team members have their neurologic music therapy training as well. The services that we do have available, we right now are offering a lot of online sessions, both groups and individual sessions. Excuse me. And then we do have some in-person sessions. Each therapist is working in one dedicated long-term care facility right now. And we also see clients in the community. And one of our therapists, rather than going to a long-term care home, she's been designated our community therapist. And so she's the one that sees clients from the community. Obviously, we fully understand, working in long-term care, the importance of the health and safety measures and PPE. And so we're super diligent with that and get tested regularly. And we kind of look to all of you and be like, okay, whatever they're doing, that's what we'll do for all of our other stuff, because we know that that's going to be, it's going to be the best we can do. So I also want to talk a little bit about how our services are funded, because that's always been a challenge for us. Many facilities do choose to spend a little bit of their budget, or sometimes a substantial chunk, depending on the home, towards music therapy. We have some homes that have a very modest budget and will contract us for an hour a week or 1 or 2 sessions a week. And we try to be flexible and supportive in whatever capacity is going to work, especially right now with COVID and everything is very atypical. We've been doing a lot of online group sessions for homes and also some individuals. So sometimes the facilities will use a bit of their budget. The other nice thing is some of our homes are using some of their entertainment budget right now to help support some music therapy in the home, because entertainers aren't able to come in the way they used to. So benefits are now starting to cover our services as well. So we support a lot of veterans who, if they've seen active duty and have a K number, and when upon discharge, if it's deemed that they are eligible for mental health supports, they will cover our services. So we have many veterans across the county that we see. Also, for our registered psychotherapists, a lot of extended health plans are starting to cover psychotherapy as a mental health intervention, which is fantastic. And then we do some private pay services as well. And we try to be really creative in increasing the accessibility. So we have many families that pay for sessions individually. And then in a lot of our long-term care homes, we work in collaboration with the recreation departments to make, we call them private groups, where in one unit or home area, we have a set number of families that take turns paying for sessions, and so that it helps share the cost. And we know right now it's a little more tricky because we can't get in there to do the portering of residents. So we're kind of relying on a little bit more support from the homes. We're looking forward to the day when we'll be able to go back in and not rely on other people to help us. But it's the best we can do for right now. But we're very flexible. We do want to, we know that these services will be so supportive for a lot of individuals. And so we want to try and make it happen if we can. Were there a couple more questions that came up during that bit there, Jamie?
I think you answered most of them with this one. The last little bit is, how do they access you? So they want to get their hands on you.
My information is on the last slide, and I think Jamie has, she has the info, like the slides. I'll make sure, actually, I think I can, I'll get to it. I want to, before we run out of time, I want to quickly go over music, how you can use music for your own self-care. It's so important. I know all of you are under a lot of stress. I really wish we were able to get into these homes and be a supportive partner right now, because I know it's really hard. But my best advice would be identify the songs that are most meaningful to you. Listen to them, sing them. I give you full authority to sing your heart out in the shower or in the car. It's going to help your mental health tremendously. Honestly, like singing 5 songs a day is better than an apple a day. It's, well, not better, but it's going to help a lot. You can also use music as part of your wind down to help ease anxiety and relax and for going to sleep at night. I know I struggle a lot with winding down and calming myself. So finding those songs that you find the most calming and soothing, and putting together a little playlist and then have that part of your nighttime routine, that can be really great. Another great one is maybe you want to, online on Zoom, learn an instrument, and that can be a great way to use music in a positive way as well. And I think that is everything. And there is my contact information on the last slide, so you can write it all down before we're out of time.
Perfect. Thanks, Heidi. On behalf of all of us at North Simcoe Muskoka SGS services team and all of the attendees, thank you so much for this presentation. I think we all knew music was quite important, but for me, it definitely put a different lens and kind of reinforced like how important and how impactful it can be with our residents. We would also like to thank all of the attendees for joining today, and for anyone viewing the recorded session. We're going to ask all the attendees just to take a moment. We're just going to launch a poll. It's anonymous, just related to the education session. Just to get your feedback, there will be 4 questions. Just scroll down in order to submit. Also, again, the recorded session for today, as well as the previous sessions, located on the North Simcoe Muskoka SGS website under the Education tab. We do have our final session for the Leadership and Innovation in Long-Term Care Team 2021 event, Wednesday, March 10th at 1 p.m. The registration link will be put into the chat box, and invitations will also be sent to the long-term care homes as well. We will also be continuing with the COVID Series 2021 Winter Survival Kit. The next session is this Friday, February 12th at 8:30 via Zoom. Debbie Lashbrook will be speaking. She's the Psychogeriatric Resource Consultant with SGS, discussing self-compassion and resiliency. Registration is free, and again, can be also located in the North Simcoe Muskoka SGS website. So thank you again, Heidi. It was a great presentation, and thank you to all of our attendees for joining us today. We really do look forward to seeing you next month.